times, I think, but it's a good example. Okay, the story you were asking about is I had a patient who called me about 6 months post-op, and she said, Dr. Rutledge, you're wonderful, I've lost weight, this is terrific, I just have one problem. And I said, okay, what was that? And she said, they won't let me go to jazzercise. And I said, why is that? She said, well, I keep passing out. I said, well, I can see where the jazzercise might not want you there. And I said, are you drinking? Remember all the stuff we were talking about earlier today about salt? She says, yes, I drink 2 bottles of water. So what she's missing there was the salt. So we switched her to Gatorade. She could have actually just had water plus crackers to get the salt, and she stopped passing out. Okay, so that means that what happened in her case is the surgery, which is so powerful, can overwhelm your body if you don't take good care of yourself. So, for example, we had another patient, and she called to say that she had a stroke. And she was about 3 years after surgery, and I said, no, you didn't. And she said, Dr. Rutledge, I didn't call to get your advice or any medical help. I just want you to put in your records I had a stroke. And I said, well, my patients don't get strokes. And I said, tell me the story. And so she said, well, my mom has been sick in the hospital. I've been taking care of her for the past 3 months. And I said, tell me about the day of surgery. What'd you have for the day of the stroke? What'd you have for breakfast? She said, well, I was busy and I skipped breakfast. I said, okay. I said, what'd you have for lunch? She said, well, I skipped lunch. I said, well, you passed out about 3 o'clock, right? She goes, yeah. You were at the hospital? She goes, yes. I said, they took you down to the ER? She goes, yes. And because they were worried about a stroke, they did a CAT scan of your brain? She goes, yes. And I said, they didn't find anything, did they? She goes, well, they said it was a mild stroke. I said, do you remember the manual? She goes, manual? I said, do you remember salt? She goes, oh, salt. I said, you have to keep up on your fluids and food during the day because otherwise you'll get dehydrated and you can actually pass out. We've actually had another lady who was going to have a stress test on her heart. She was made NPO. She couldn't eat after midnight. She was supposed to have it in the morning. They said, no, you can't have anything to drink, and the machine broke, and they couldn't do the test on the treadmill till 3 in the afternoon. So she had gone from night until the next day at 3. Then they put her on the treadmill, and as while she was walking, she kind of started to get a little woozy, and her speech started to slur, and she started to get kind of like she was fainty. And so they told her, you have a mild stroke. And she called me, and I said, no, because all that time had passed. Just have a little salt water or Gatorade, you'll be fine. And so she didn't have a stroke. Many of my patients work outdoors in the sun. So they work hard jobs outside in Las Vegas. They work on road crews or things like that. And they can do that fine as long as they keep up on what they drink. So when you're dancing, what you'll need to remember is keep a little something there so you can have some sips or something to eat.
I would say because I'm a singer, so I'm always like on stage and not really.
How long until you get off stage? How long would you be on stage at one time? Hours?
Upwards to maybe an hour.
Okay. Before you go on, you have a little bite of something or something to drink. Keep a little bottle of Gatorade with you. Some people, if you're going to go out on the strip or go out to Las Vegas, you have a fanny pack with a little bit of a bottle of Gatorade or something, and you can have some crackers, or we heard about pretzels. Salty things like that. And then as an emergency, in an emergency, you know the little salt packs you get at McDonald's? Just tear one of those open and that will boost your salt. Yeah.
Oh, I did have one. Oh, sorry, I'm keep asking questions.
No, this is good. There's very good questions.
Stop it, it's my turn.
I'm sorry. Okay, but I was gonna ask about the salt. Because I was thinking about the 3 guys,
the 3 kings.
Yeah, the
right.
3 kings. They're having like salt water.
Yes.
Do your taste buds actually change and you like salt?
No one I've ever met likes salt water.
And so they didn't like it, no?
No, nobody likes salt water. But you can have some salt with a glass of water. You can have there are drinks, the alcoholic drink. What's the alcoholic drink that has the salt on the outside, Paul?
Margarita. Oh,
yeah, they're good. Yeah, margarita with no alcohol. What do you put in it? What do you drink?
I don't drink.
No, I mean, but what's in the margarita besides the salt on the outside?
Oh, you mean margarita mix?
That's like tomato juice.
No.
Margarita.
That's Bloody Mary.
More like a wine.
It's green sugar.
Green sugar? Okay, well, but the salt part's good. What's the one, isn't there grapefruit juice and salt? A drink?
Salty dog.
Salty dog. Have a virgin salty dog.
Yeah, right.
Yeah, so that's great. That's grapefruit juice. So, but you're getting the salt. That's the idea. So, mixing salt and water, that's drinking seawater.
Yeah.
No, most people don't like that. But there are ways to mix salt. You know, have a salty cracker. Have a pretzel or something like that.
Okay. I was gonna say because one of them said that it actually tasted good.
What, salt water?
Yeah.
Well,
Yeah.
some people might like it.
Yeah, I don't think I can remember seeing anybody who said that more than once. Most of our patients do not drink salt water.
That's it.
Okay.
I'm Barry Nelson. I'm from Lubbock, Texas. And I'm fat. But I've never felt so good about being fat, so I've basically found you because of Buck Rogers.
Right.
Love Buck.
Yep.
Love Gil. No, actually, my wife has kind of been on me for a long time. And so I started talking to my doctor, talked to my cardiologist first. He's like, no weight loss surgery, not around here. I would not dare put you in the hands of these surgeons around here. Talked to my regular doctor, he's the same way. He said, I have patients who have a lap band, they do the Roux-en-Y. He said, I'll be perfectly honest with you, Barry. He said, they just don't have good results. He said, they start off, they do fine. He goes, but after time, they just don't do well. And so I kind of used that as an excuse. And but I kept looking, and because I wanted to do something, but everywhere I looked at, I just kept finding horror stories, and I'm just like, I can't do this. Which I guess one of those horror stories, I guess, ultimately led me to your website. I'm not
That's a
sure.
great length.
I'm not exactly sure which one. Anyway,
Horror stories or Dr. Rutledge.
and the first thing I watched was the Gil Gerard thing because I actually was a big Buck Rogers fan. I thought, hey, now that sounds
Yeah.
pretty good, and your website really sucked. So I was actually encouraged by that because I was encouraged by that because it was obvious to me that you weren't throwing all kinds of money into making it look good and pretty. I mean, it was. I'll be perfectly honest. I mean, if you go to the lap band website, it's all nice and flash.
Glittery and
Great
glamorous.
graphics everywhere, and I knew that when I went to your website, it was nothing but business. And it's not hard to navigate or anything. It's just not the best looking website.
Maybe the business.
I had
It is great. I love it.
we had a patient. We're doing around. This one lady says, we're introducing herself. She says, I'm a website designer, and she said what you said. Your website, not that good. I mean, she said use a different language, but
You just don't have to serve around.
and I said.
Let me just say, you know what? He actually designed that website. I mean, he's a computer genius. Actually wrote the trauma registry that everyone uses around the world.
Oh,
You're
no.
insulting your
Oh, sorry.
surgeon.
Well, I'm more of a graphic designer, so that's
Yeah,
just
that's why.
that side of me. It's not the.
No, you're exactly right. But we have.
Production's great.
Yeah, but we are so highly ranked on Google. I'm afraid to screw with it too much, though.
Yeah, right.
Yeah.
For sure.
But we had a web designer, and she said, your website's terrible. And I said, well, I'm your surgeon. I'm not sure I would have said that.
Yeah, maybe I shouldn't have said that.
That's right.
Kind of like paying the anesthesiologist.
That's right.
I only have a couple of questions. I'm just not even nervous about this. So I'm really
That
looking forward
insult
to
might
it.
be-
Yeah. Buck Rogers, hey.
Well, the latest on Buck Rogers, of course, that we really feel excited about. Of course, he's done well from a variety of standpoints. But one of the most important things is that he had what's called atrial fibrillation. And that is a devastating impact on your survival. In other words, people who have atrial fibrillation, their heart beats irregularly, and they have a 5-year survival that's a little bit less than having colon cancer at 5 years. In other words, they have a high death rate from blood clots going to the brain, things like that. And what was very exciting, his cardiologist was not really 100% behind having the surgery. His medical doctor, as you saw on the show, was ecstatic and loved it. But about 6 months afterwards, he started to improve. He had a lot of his heart medicines were able to be stopped, but he stayed on the atrial fibrillation and some blood thinners. So I kept asking if his cardiologist would consider trying to reverse the atrial fibrillation and getting him off the blood thinners. And after a year, he finally had lost enough weight, his heart dimensions had decreased in size, and they shocked him, and he no longer has atrial fibrillation. So wow. It's an example of another one of those kind of life and death things which we really have a big impact on. And a minute ago we were talking about kind of one of the negatives of the surgery. We can't really guarantee what your weight is going to be. On the other hand, we might turn to a more positive view, which is, are you going to live longer with this surgery? Are you going to have a better quality of life? Are we going to take away diabetes, heart disease, high cholesterol, high blood pressure, osteoarthritis, sleep apnea, lung disease? And the answer, 85 to 90% in all those diseases is yes. On average, if you look at predictive models that you can look at about how long you're going to live, if you take our average patient, which is a 39-year-old, 300-pound woman with high blood pressure and diabetes, they're going to live on average, according to different computer models you look at, on average to around age 65. And if you then look at that same patient at age 39 who weighs 150 pounds and no longer diabetic and no longer hypertensive, they live on average to 85. So it would be a terrible tragedy if your wife, Paul, did not lose all the weight that she wanted. But imagine if we could avoid breast cancer. Imagine that we could give her a longer, healthier life. If she doesn't get to that size 6, that will be my fault and I will apologize. I want people to lose the right amount of weight. But if you look at the big picture as far as health, what we're talking about for the patients that we operate on, we're talking about avoidance of some of the complications of the lap band, avoidance of many of the complications of the Roux-en-Y, a long and healthy life free of some of the really devastating complications associated with obesity. And I don't think, did you introduce your wife? I mean,
oh no, this is my supermodel wife. Her name's Jamie.
Sorry for his insult. I think your website is awesome.
No, I think it could be a lot better, and I kid about it. But in fact, some of our patients who are graphics designers or web designers have said, we'll work with you, and I'm very interested in that. So if somebody wants to barter a little bit of, I'm willing to do it. But I'm not willing to change that one. See, what I would do is, like you said, there are some of these what are called, for those who are not sure, there's something called Flash. Flash is a kind of web software that lets you do graphics and video and things like that. So my website, the present one, I would leave and make a really nice one in Flash, because this one has so much text it ranks high in Google.
Yeah, that's exactly.
And a lot of people do like that, as opposed to seeing the Flash and the, having 4 places to go and 4 things. I mean, mine has, I think it's like 2,000 pages to it. And it's dense with lots of research and references and video and audio and everything I can put there. And it is something I think I could do a lot better with, but it just got such a high rank in Google. I'm afraid to fool with it too much.
No, I wouldn't either.
Yeah.
You should pimp up your YouTube though.
What's that?
You should pimp up your YouTube.
Pimp up my YouTube? Can you do that? Can you?
Yeah, they have like HTML,
Oh, really? I didn't know that. So I can change my YouTube front page now?
Yeah.
I didn't realize that. Okay. Like MySpace, you can put some HTML stuff around it?
Yeah.
I'll have to look at that. Okay.
Also MySpace.
Okay. Yeah, MySpace, I haven't kind of gotten into MySpace that much, so that's a little flaky, but maybe it's okay.
I have a question.
Yeah.
Or actually 2 or 3. Hair loss a problem? I've heard.
Not in your case. Wait a minute, I'd like it clear who does the jokes here.
Yeah. You're really good.
That's in case the surgery doesn't work out. We got to
That's right.
put in the lounge shows in Vegas here.
I'm currently on like 10 prescriptions,
Not doing it.
Who and when and how do I mean, I just keep on taking those? Do I need to
Well, do
check
you,
with my regular doctor?
no, we're going to handle all that. Are you able to go through them now? Do you remember? Or do you need to?
Yeah,
All right, just go through them one at a time. I'll tell you what to do. When's your surgery?
Tomorrow.
Okay, so go through them. I'll tell you whether to take them tonight or tomorrow or not take them at all.
Metformin.
Do not take it tomorrow.
Okay. Actos.
Do not take it tomorrow.
Januvia.
Do not take it tomorrow.
Norvasc.
Do not take it tomorrow morning.
Lisinopril.
Do not take it tomorrow morning.
Vytorin.
Vytorin you can stop taking now. Don't take it again, ever. We're going to fix that.
Cool. I'm taking the Lavanza fish oil.
Yeah, don't take that.
Fish oil. Tricor
Don't take that.
and Paxil.
You can keep taking that for sure.
Yeah. I stopped taking it one time accidentally, and I thought I was being abducted by aliens or something.
Yeah, it has we're going to talk a little bit
I
about...
felt like I had a really bad cold.
Yeah, that's withdrawal syndromes from some of the SSRIs can be a problem, so you don't want to stop that. We'll talk about some more. If you'll bring that up tomorrow, I'll do a little video on what to do about that.
Okay. A couple other things.